DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there, folks. Dan Thompson here. Thanks for joining us today on DocTalk. We have a great show lined up. We'll have Dr. Jan Shearer from Iowa State University join us to talk about dairy cow lameness. It proves to be a great show. I'm glad that you joined us. Stay tuned.
We're cow-calf producers from northeast Colorado. We run about 300 commercial cows and calves and sell them at the sale barn in October.
Since we've been given multi-min, our reproduction rate is about 95%, which is pretty good for grassland, and we run bulls and we do not AI.
That means an extra 15 calves at sale time. We've been using the multi-min product for 3 years. We are really happy with it and recommend it to anybody in this business.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Jan, welcome to the show.
Glad to be here. Thank you very much.
Folks, this is Dr. Jan Shearer, and Dr. Shearer is a professor and extension specialist for the Iowa State College of Veterinary Medicine, and it's a treat to have him on the show. He's known internationally for dairy cow lameness and veterinary medicine, and just thank you very much for taking time out to be with us. It's an honor. So let's start out with dairy cow lameness, and what are some of the things that when you're sitting here first, you know, how do we define the problem?
Lameness is basically anything that affects the mobility of an animal. It's normally defined as any kind of a condition that will cause an abnormal gait, usually defined as an animal that is lame in one or more limbs. And that's the predominant way that we see the problem in most of our herd situations.
Okay, and it's one of those things in a dairy situation that's, mastitis, scouring calves, lameness. I mean, it's a very it's pretty prevalent.
Yeah,
from can be
very prevalent disease, and at least some of the work that's been done defines prevalence rates of somewhere between 20 and 25% of all animals in dairies today on average. And so the problem, and when we look at incidence, for example, incidence can be as high as 30 to 50% in some herds. Now, obviously there's herds that do a lot better, but lameness is certainly one of the most costly conditions, clinical conditions that we see in dairy cattle by far, and also one of the most important from a welfare standpoint as well.
You bet. You bet. Well, what are some of the and we don't have any specific order that we have to go through this. It's just some of the things that we generally talk about. But what are some of the clinical signs that, we obviously know the limping cow, but what are some of the more milder or less obvious signs?
Yeah, that's important, because those are the kinds of behavioral things that we look for in animals that are showing maybe subclinical forms of this condition. Cattle as prey animals naturally will hide their discomfort, and so as a consequence of that, we look for other subtle signs, more subtle signs of lameness to really identify it. One can be arching of the back, one can be bobbing of the head when they put down the painful limb. We can also see postural changes, and when looking at cattle from the rear. So there are a number of other behavioral things that we look at in terms of lameness that can kind of give us an indication of when this is occurring at a subclinical or early stage.
You bet. Well, we're going to take a break, and when we come back, we'll talk more with Dr. Shearer about lameness in dairy cows.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Join the team, the Beef Quality Assurance Team. Getting BQA certified shows you're committed to practices that produce the highest quality beef in the world. And by visiting BQA.org, you can take the online certification course at a time that fits your schedule and from the comfort of your home or office. You'll also find lots of helpful tips on improving animal health and animal handling practices. Get certified, BQA certified, because it's about doing the right thing. Visit BQA.org today and become a member of the BQA team.
In the springtime, cattlemen need to be thinking of preventing important diseases like pink eye. Pink eye prevention includes management factors like good fly control, pasture management, along with a good vaccination program. Eyesight from AgriLabs has broad efficacy coverage as its origin from 8 different field isolates of Moraxella bovis. It is safe, smooth, highly syringeable, safe with young calves and pregnant cows, and provides superior protection against pink eye.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations.
Welcome back to DocTalk. I'm Dr. Dan Thompson here with Dr. Jan Shear. And Dr. Shear is a professor at the College of Veterinary Medicine at Iowa State University, which is my alma mater. He's also has an extension position there. And Jan, thanks a million for being here and spending some time talking about a very important topic.
My pleasure, for sure.
So let's talk about what are some of the main causes of lameness that you see in dairies?
I think you can break them down into roughly 3 different categories. One would be individual lameness that affects the individual digit or claw, as we might refer to it. We also have infectious disorders of the foot skin, and then there are a number of disorders that are associated with problems that are above the hoof, or what we might refer to as upper leg lameness conditions.
Okay. And so, kind of talk me through, give me some examples of what we're going to see within those categories. Some of the things that, foot rot, laminitis.
Well, 90% of lameness that occurs in cattle occurs in the foot. Most of that, 90% of it, in fact, occurs in rear feet, and somewhere in that 70 to 90% affects the outer claw of rear feet. And
that gets it narrowed down pretty quick, doesn't it?
And that's particularly true for cattle that are housed on concrete or hard surfaces. Of course, it's a very unnatural surface for cows, and so they're certainly designed much better for earthen surfaces. So that's a part of our problem. And the kinds of conditions we would see as far as claw disorders or individual disorders of the digit would be ulcers, white line disease. And of course, there's always things that can cause traumatic lesions of the sole. That might be stepping on a nail, or it might be stepping on a stone, or something like that. So those constitute the majority of the kinds of conditions that we see that affect individual claws. And then we also have in our large dairy systems today some problems with excessive wear of claws that creates for us also some ulcer problems in claws. And that's become and is becoming a bigger and bigger issue for a lot of our dairies.
Sure. So then when we move to some of these more infectious types, what are some of the things that you're seeing as infectious types of lameness?
Again, I think we look at the environment of the dairy cow. It's because of the fact that we have them in confinement situations. We're looking at conditions like digital dermatitis, foot rot, interdigital dermatitis, and erosion of claw horn. And those are very important conditions as well, and true infectious disorders of the foot skin.
Okay. And so then we spend some time with the crews. We're coming up on our break here. But, you know, some of the things as far as treatment and prevention, obviously the prevention's the key.
Prevention is the key. There are a number of things that we can do. First of all, make sure that our facilities are designed right. Flooring is surfaced correctly. Make sure that we've got a comfortable place for cows to lie down. Manage our rations so that we avoid problems with rumen acidosis and laminitis.
Yep. And I think that we'll continue on with those, and as we come back in the break, maybe dig down a little bit deeper.
Great.
Thanks for watching DocTalk. We'll be back in a minute.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. And by Lameness Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition. Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Multiman is one of those products you can use to get the ultimate performance out of cattle. Around 90 to 95% of our calves are either AI or embryo transplant. Since we've started using the Multiman, we're up around 70 to 75% conception on our first AI service. And a product like this is very beneficial for us.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Jan Shearer, who is a professor at the College of Veterinary Medicine at Iowa State University, and he's also extension veterinarian. And Jan, we're talking about lameness in dairy cattle and infectious disorders of the foot skin. Sounds very technical. Yeah. What are we talking about with this?
Yeah, we're talking about predominantly foot rot and hairy heel warts, right? Okay. Foot rot is a very important condition in both beef and dairy cattle. It is a condition that starts usually with a lesion in the interdigital skin or a cut in the interdigital skin that secondarily becomes infected. We get tremendous swelling of the foot. And it sometimes can have some very bad secondary complications, such as involvement of a joint in one of the digits, and that can lead to some really chronic consequences. Yeah, the digital dermatitis or hairy heel warts is the more common name, the name that most people would know it by. is really a serious problem in the dairy industry. We've struggled for many years. It's been around since 1975, maybe a little earlier. And we continue to try to manage this thing predominantly with foot baths and with topical medications and so forth, but it's a really tough one to manage. And unfortunately, in recent time, we're starting to see this become a very significant problem in feed yards, where it's even more difficult to apply those same kinds of treatment approaches. It's just not convenient to manage it that way. And so everyone's on the hunt for a vaccine.
Sure.
So hopefully we'll get there in the near future.
Well, I think that vaccines for that, or vaccine, you can't manage from a bottle. You and I both know that.
That's for sure. This is one that you have to manage the environment with as well, and the dairy industry is struggling to do a better job of that. And I would say surely the ones that are successful in managing the disease, along with these other treatment modalities, are the ones that are trying to manage the environments better as well. Absolutely, that's important.
Mineral or nutritional components to this?
Most definitely, trace mineral nutrition is important. Yeah, nutrition has a key role in making this skin have greater integrity and greater resistance to these problems. So, absolutely.
Well, when we come back from the break, we'll kind of do a progression and maybe talk about some of the preventative measures that we see in dairies and preventing lameness. But it's just, like I say, it's an honor to have you on the show, and for you to take time out, it means a lot.
It's great to be here. I really appreciate it.
Great. We appreciate you watching as well, and we'll come back with more with Dr. Jan Shear right after the break.
This is Agriculture Today from Kansas State University. Interest in growing the oilseed crop canola is rapidly rising in the Central Plains, and in partnership with seed company Monsanto, K-State is on the verge of releasing 2 new glyphosate-tolerant canola varieties well suited for the region. Kansas State's Mike Stamm talks about their attributes.
I would say winter survival was probably one of the key traits of these varieties, and they've also been very competitive in terms of yield with the current varieties that are out there. 352 also has the sulfonylurea herbicide carryover tolerance trait. That gives wheat producers that are using these long residual sulfonylurea herbicides in their wheat production to plant canola the following year.
This is K-State Research and Extension.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
American innovation is being driven in places you might not expect by people like Brent Hayek, an Oklahoma family farmer, who recently set a world land speed record in a Ford Super Duty pickup truck powered by renewable B20 biodiesel. Advanced performance is here, now, putting America on the fast track to more jobs and energy independence. Biodiesel, America's advanced biofuel.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, folks. Welcome back to DocTalk. I'm Dr. Dan Thompson here with Dr. Jan Shear, who's a professor at the College of Veterinary Medicine at Iowa State University, and we're tickled to death to have him here. We're talking about dairy lameness, and let's talk a little bit about some of the prevention, the care, what do we need to do to try to curb some of these things from happening?
I think one of the most important things is owners need to have a commitment to managing foot care. They need to see it as an important problem in their operations that needs to be dealt with. And that would include then making sure that they have a regular foot care program in place. That would include either an outside trimmer maybe, or it could be people that are trained on farm to deal with these things. They need to be trained. All those folks need to have some training, I believe. Foot care is not a simple thing to manage. There's some really complicated issues there. But I think with a little training, we can really make a major difference in the amount of lameness that we have, and certainly the impact that it's going to have on not only our performance, but also on animal welfare.
So when we start talking about foot trimming, and some of those as preventative or treatment, how often and how do you determine which animal is going to be trimmed?
Yeah, it really depends a lot. I have kind of learned over the years there seems to be no one size fits all when it comes to that. It seems like in certain types of environments, such as the Southwest, where we have a lot of dry lot, feet tend to grow a little faster, and have a little less wear, possibly. And so the foot growth and wear issue becomes really critical to how much trimming may need to be done. And then, of course, the other factor is lameness varies from farm to farm, and so we need to place a high priority on managing lameness disorders as they occur. And so that needs to be the first priority, and then the trimming program can kind of help prevent some of those kinds of things, as well as some of these other things that we've talked about a little earlier in terms of managing these infectious skin disorders. That would be cleaner environments, cleaner, drier environments, and then also foot bathing as necessary.
You bet. Well, I think it's important for like we talked during the break, of creating the culture of on a farm or on, it's not something that you can just check a box and it happens.
Absolutely right. On the operations that keep lameness to a minimum, you can see a clear commitment on the part of the ownership, the managers. It's just, it makes all the difference in the world. The culture that is created, as you say, the culture that they create for having good foot care.
Well, I sure appreciate the culture that you create within our professional organizations and within our industries, and appreciate everything you do.
Oh, thank you very much, Dan.
Thanks. Thanks, folks, for joining us on DocTalk. If you want to know more about the show or see an archived episode, you can go to us on the web at www.doctalktv.com. Remember, always work with your local practitioner. I'm Dr. Dan Thompson from Kansas State University. You've been watching DocTalk. We enjoyed having you with us today, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
My name's Tim Todd. Along with my wife Chris, we own and operate Green Mountain Angus Ranch out of Rygate, Montana. We've been in the Angus business for about 30 years now. We sell about 350 bulls a year. We have a production sale in the fall, the third Friday in November, and we have a private treaty sale in the spring. We've been using the Multimin product for about 7 years now. We started using it off the recommendation of our embryologist. He suggested that we give our recip cows a shot prior to putting embryos in. We had a real good conception rate that spring, and we've been using the product ever since. This area of Montana can be a little deficient in copper. That's one of the three main minerals in Multimin, and so that we brought our copper levels in our cattle up to where they need to be. We've seen an increase of 5 to 6% in our conception rate in our AI program. You start getting 30 to 40 more AI calves in a year. We're showing a huge return by using the product in those regards. We give our cows a shot of multi-min pre-calving for the immune system of the unborn calf. She will transfer the minerals into the unborn calf through the blood system. When the calf is born, he has a high level of mineral in his liver, which will help with his immune system. In our particular operation, we lease a lot of pasture, so it's real important for these cattle to stay healthy. We don't get the opportunity to check them like we'd like to. The least sickness, the least foot rot we have, the better off we are. So with the use of multi-min, that's two of the big benefits we've seen. Healthier cattle, less maintenance.